Hello, beautiful people, and welcome to Bipolar Lines, your lifeline for honest, unfiltered conversations about loving someone with bipolar 1 disorder. I'm Laura, flying solo today without my co host Brooke, who was unable to make this one, but I am not completely solo because I do have a very special guest I'm going to introduce in a minute. Bipolar Lines is a podcast where Brooke and I share our experiences with you as spouses loving someone with bipolar 1 disorder. Each week, we dive into the messy, beautiful truth and sometimes, hopefully, practical skills that helped us so that we can help you. To our OG listeners and new, if our show speaks to you, please be sure to like, subscribe, or follow us on your favorite platform. And you can also join our Facebook group, Bipolar Lines Pod. It's a private group and a safe space with the option to post anonymously. Okay, so today's special guest, I'm so excited to introduce, is Kate Rawlinson. She's the lead of the Colorado Mad Moms, which is a grassroots coalition of family members or caregivers who have someone with severe mental illness. So, Kate, welcome.
Thank you, Laura. Nice to be here.
Yeah, it was so great. I was introduced to you last year off a article on my phone from like the Colorado Sun, and I don't even know why it showed up. I swear your phones listen to you and just know what would catch your eye, but I was like, what? There's like a nonprofit that's advocating for mental health in Colorado. Who are these people? And so I read that article, and then I of course went to your Facebook group because you have a Facebook group, Colorado Mad Moms, and started learning all about it. And it was pretty exciting time that I jumped in because you all were just, doing advocacy days at the Capitol and trying to get bills passed. And anyways, yes, please tell me more about Colorado Mad Moms.
Okay, thank you for that intro. Um, well, we are a coalition, as you said. We're actually not a nonprofit. We are a project of a nonprofit, which is the Colorado Nonprofit Development Fund,
Oh, I
and
did not
they
know
are a
that.
501c3. We see ourselves a little more like a guerrilla organization that, we're grassroots and we want to go in and we want to change things. And we don't want to spend a whole lot, and we're a full volunteer organization. So we want to spend a whole lot of time with all of the uh, paying of taxes and everything else. So
Yeah.
they do that for us. And it's
Okay.
really a wonderful relationship. And I'm so glad we did that. We've been part of their organization, a project of their organization since last December. So just about a year coming up December 1st. We formed ourselves in August of 2024. Um, I was already quite active with a group called the Angry Moms, and it's so funny. We're always mad or angry, but around these issues, deservedly so. And
Absolutely.
the Angry Moms was a national organization that was advocating for the medication, the antipsychotic called Clozapine, to be removed from a very restrictive and I think discriminatory system and made it to access it. And so there was a lot of claustrophobia, fear of prescribing it with doctors because of the restrictions the FDA had put on it. So anyway, we were able to push and make the FDA bring it out of that system. So since last February, clozapine has been much more available. But through that advocacy work, going to DC, going to participating in, online efforts and letter writing and everything, that's where my advocacy got started in terms of mental health issues. I actually come out of the arts and nonprofits, so it was a big switch for me. But because I have a almost 33-year-old son who has schizophrenia, it's very important. I've had to, as you said, educate,
Mhm.
myself, and most of us moms have to educate ourselves. And that's a primary goal of our organization is education, advocacy. So as you said, going to the Capitol, talking to legislators, running petitions, testifying in person and online for bills to be passed. And then the other part is support. So, like you and Brooke, and now knowing that there's someone else who's going through a similar experience is huge.
Yes.
We're always sad when a new person joins our Facebook group, but at the same time, we're very glad that they have us. And over they say, I'm so happy I found you. I
Yes.
feel so alone because of the stigma,
Hmm.
really, of serious or severe mental illness. And I'm not talking just anxiety and, you know,
Yeah,
even
let's
just,
talk about severe mental illness. Let's
okay.
talk about the definite what defines that.
Okay. Well, most medical professionals say serious mental illness. Now, the Treatment Advocacy Council, center, excuse me, that in DC that really focuses on severe mental illness and was formed by E. Fuller Torrey, who was one of the founders also of NAMI. Um, he he advocates that these illnesses and they're psychosis spectrum disorders. They're defined by, again, medical professionals. They include schizophrenia, schizoaffective disorder, which is schizophrenia plus another disorder. So it could
Yes.
be plus BP or plus
Yes.
autism or plus something
Oh, I
else.
didn't realize it could be plus like autism or I thought schizoaffective, I haven't researched that a whole ton, but was just where you could get psychosis even when you were in mania. So that must not be it.
Well, it can include, OCD or, yes, mania. So some bipolar, excuse me, kinds of symptoms.
Hmm.
Um, but it can include kind of a range of things. You have to always think about mental health or mental illness as being a spectrum. It's not necessarily,
Yeah, yeah.
I am totally schizophrenic, you know,
Yeah.
which I would never say. I always say someone living with because
Yes.
we are not defined by our illness. Um, but schizophrenia, schizoaffective, bipolar 1, bipolar 2 is not
Yeah.
considered severe mental illness, and major depression with psychosis. Now, we tend to focus on the first three because those, just they're more dominating, I think, than,
Hmm.
they take up more of the space. And bipolar one, as you all know, is can and does have some of the symptoms that of mania, but also psychosis. So
Yes.
again, it's a spectrum. Autism is down toward one end, so is what's the other I was trying to think of? OCD, eating disorders. Those are extremely serious illnesses, but they're not necessarily severe in the sense of how debilitating, the
Hmm.
level of disability that they can cause. They're all brain neurological disorders, so people can have a combination of them. They may have eating disorders, but they have schizophrenia, and
Hmm.
they have manic or mood disorders, but they have schizophrenia. So we're complex.
Definitely.
Our brains are incredibly complex. And we also, they tend to be, they have usually, not always, a genetic component. Sometimes, schizophrenia can be caused by viruses, it can be caused by bacteria, it can be caused by trauma, it can be caused by drug use. You know, there's just, it can be, there's all sorts of things that can trigger schizophrenia symptoms, you know.
Yeah.
But my argument is that in most cases they can be treated, and we don't
Right.
do a good job of doing that.
Yeah, I wanted to go back to something you were saying about, you think a lot of this comes about because of the stigma. And just I wanted to kind of piggyback onto that because before the podcast, you and I were talking before the recording, where I was saying when my husband was diagnosed with diabetes, for example, we came home with a whole book on how to help him. But when he was diagnosed with a serious, severe mental illness that torches our life, that will nuke our life, we got nothing. We gotta bye. Send him home. And
Yep.
so like families, I mean, it's you I mean, Brooke and I always say the most important thing you can do to start if you have a loved one with this is to educate yourself. And it sounds so like I feel like sometimes it just goes in one ear and out the other because it's like, yeah. I know that I need to learn about it. But like, no, you really need to educate yourself. You really need to understand. I mean, when my husband was diagnosed, thankfully, my mom's hairdresser had family members with bipolar disorder and was like, gave my mom all these resources for me to go to. And so I went to all
Mhm.
these resources and I found
Right.
a support group, and it was really eye-opening when I was reading books on this and everything. So education is so important, and sometimes you
Yeah.
only get that through your support groups, which is why I think what you're saying is when people find Colorado Mad Moms or even our group, the Bipolar Lines Pod, they are like, we're so thankful we found you because you feel so alone. And it's kind of like, well, where do I go to learn this? The professionals aren't teaching us.
Yeah, exactly. I mean, there's so much there that I could address, but the stigma is not only for the person who has the illness, it's for the whole family.
Yeah. Yeah, it really is.
So we lose family members, that don't want to associate. We don't get invited to weddings. We don't,
Mm-hmm.
I mean, there are family events that people just, they're so afraid of it. And I think partially because the genetic component is there in many of these disorders, not all of them, but
Mm-hmm.
in one family, like in my own family, there's a history of maybe it's been 3 generations, I think, since someone else had schizophrenia. But there's a lot of developmental disorders. There's autism, there's bipolar, there's even just epilepsy. I mean, these
Mm-hmm.
are all neurological disorders. So
Mm-hmm.
I always say, hey, we got some funky genes, and it's on both sides of my parents' families.
Mm-hmm.
And, skipped a generation with me, but then, hit my son. Now, I have a
Mm-hmm.
brother who is probably undiagnosed bipolar 2, maybe 1, I'm not sure,
Mm-hmm.
but I feel like I've lived my entire life with someone with some level of mental illness. And now that I'm old enough to look back and really admit it and understand, the trauma that I endured as a child because of situations like my brother, and who
Mm-hmm.
was a ticking bomb,
Mm.
basically. I
Yeah.
always say, oh, I learned to run fast, you know,
Oh, yeah.
because, it was, he was unpredictable. And
Yeah.
my son, the very opposite of that as a child. He
Mm-hmm.
was, extremely gifted. And I was in like the all county orchestra
No.
in middle school in the fourth largest school district in the nation. So I mean, he was 130 IQ, and it didn't hit him until his teens. And then
Yeah.
I thought it was just, teenage behavior,
Mm-hmm.
rebellion, that kind of thing.
Yeah. I think that
You
would be
know,
hard too, especially when I don't know, no parenting too. Just I don't know. There's no
yeah,
guidebook for that
you
either.
don't know.
Yeah.
Yeah, you don't know. So the education issue, once he had his first episode, which was really when he was around 19 or 20, and he had been self-medicating quite a bit before then. So the drug use didn't help by any means.
Mm-hmm. Sure.
But when he had his first episode and then was diagnosed, I did a deep dive, So it still took me years because I was so isolated. I didn't know
Mm-hmm.
anyone else.
Mm-hmm.
I moved up to Colorado from Miami, hoping that a new area would help him not go back to old habits and routines and such, and it didn't. He still had years yet to of real hell and dysfunction.
Mm-hmm.
And not one doctor ever mentioned clozapine in 10 years.
Yes, let's talk about that. So recently, I had only become aware of that term that you say it better than me. I know I mispronounce it. What's the term where you don't know you're sick?
Oh, anosognosia.
There,
Is that the
anosognosia.
one? Yeah,
Yes, yes.
anosognosia. Yeah.
I only became aware of that term in the last couple of years, and it's something my husband has had every single time. And no one
Mhm.
told me that. No one told him that.
Right. You
It's
know
just
what?
like,
The
why
number of
not?
Yeah, the number of mental health professionals who don't know that term is staggering to me.
Oh, so
It's
yeah,
just
you're saying even
they
mental
were
health
never taught.
professionals don't know.
Right.
Yeah, because it would be a thing. It's like, you know, intuitively as their family member, you just don't know how to explain that to people. Like you don't know, like I remember trying to explain to, you know, the police or whatever when they get called. I'm like, listen, like he's really sick. Like he doesn't know it though, but he
Yeah.
is. And they're
Yeah.
just like, whatever. I don't know. It's just, it's like you knew it, but like you didn't know there's a term for it. And I don't know. No one, they act like you're the, like
Yeah.
you're, I don't know.
Well, luckily, there's a lot of education going on
Yes, there is. So let's
now
talk about
around it,
that.
and it's being more commonly used, and more professionals seem to know what it is. And what I what I discovered at one point through a presentation, I think this is again the Treatment Advocacy Center. They have great educational programs, by the way. Um, they there are functional MRIs of a brain that is not impacted by schizophrenia and or any of the spectrum psychosis spectrum disorders. And then there's an MRI of a person who is diagnosed. And there are a series of questions that psychologists or research people know to ask, and there are self-awareness questions. And so a person who is not impacted by a serious brain illness, that part of their brain, and it's in the prefrontal cortex, actually lights up when they're asked those questions. You ask a person with SMI, and that part of the brain does not even light up. So it is
Wow.
it's a physiological part of the illness.
Is that when
And then,
they're actively ill, or is that that would just have to be when they're actively like in an
yeah,
episode,
it's when
right?
they're actively ill. Because, like with my
Yeah.
son, after being on Clozapine 6 months, he began to understand that he had a brain disorder.
Oh,
You
that's
know, we don't
amazing.
talk schizophrenia a lot because schizophrenia has so much shame attached
Yeah.
to it, you know. And for young people, I think especially, you know, I mean, he knew when his brain was changing. I mean, he would tell
Yeah.
me, we were quite close. He would say, "Mom, I'm losing myself."
Oh, gosh.
You know, it was just brutal. And he knew that he was disappearing, you
Yeah.
know,
So
and
this
he's back.
drug, clozapine, right? Is that how you pronounce it?
Mhm.
So this drug is designed to treat the anosognosia, correct?
You know, it's designed to treat the inflammation because
Oh,
basically these illnesses are caused to a great extent by inflammation and neural degeneration. So the neural network is very, robust in a normal brain, but it requires, a complex chemical system, to stay healthy. And glutamate is something that disappears a lot in people with schizophrenia, and usually sometime in their teens. That's why they tend to have their first episode as, say, a freshman in college, or, for some people it's
okay.
earlier, and some
Yeah.
people it's later. But,
Yeah.
it was originally known as dementia praecox,
Interesting.
Praecox. So, which means basically early or immature dementia, as opposed to the dementia of an older person.
Wow.
So, it is a form of dementia.
Yeah, you know, it's so interesting you've brought that up before because when I've had people ask me for advice or they'll say things like, you know, my husband's saying the most horrible things to me, even though they're in psychosis. I really want, for one, Brooke and I talk about separating your person from the illness. So you kind of alluded to that earlier when you said that's why you don't say that he's schizophrenic. But so you have to do that. And we have to do that with bipolar too. You separate your person from the illness. And the
Mhm.
illness is the one that was talking to them. And sometimes I would tell people, I'm like, if you really think of it, because my grandma had dementia and she was actively in it a couple of years ago. And I remember saying, like, it's very similar to my grandmother with dementia. Like, my grandmother never yelled at me, not in a way that I didn't deserve it, like if you were, if you need to be safe or whatever. But I remember visiting her once, and she, yeah, literally screamed at me, like, to get out, and I mean, I cried because I just couldn't believe my grandma acted like that,
Yeah,
even though I knew.
yeah,
But I could at least say in my head, that wasn't my grandma. My grandma would never yell at me like that. You know what I mean? And so I was telling people, like, spouses, the same thing, like, that is not your person. That person that's saying those mean things to you in psychosis isn't your person, similar to how that wasn't my grandma who
yeah,
yelled at me.
right,
So anyway,
exactly.
that's interesting
You
you
know,
brought up that
and
correlation
they,
to it.
yeah, and the denial, because they will, if you say, well, you're really sick, you need to go to the doctor. They're like, no, I'm not
Yes.
sick. There's nothing wrong
Yes.
with me. They literally do not have the capacity when they're ill to know that they're ill.
Yes.
So, clozapine for my son and for 70% of the people who take it, and especially if they're titrated up with this new protocol that Dr. Robert Laitman, developed. It's called the EASE protocol. And don't ask me what EASE stands for right now because I can't remember. But it's Dr. Laitman's protocol, and he has a website I recommend people go to called Team Daniel. And Daniel is his son who has schizophrenia. And I'm going to do a little plug for us right now because
Please.
I think it's very important, and we're focusing on clozapine for the next month. Next week on the 19th, in our Listen Up series, which is a Zoom talk once a month, we bring in an expert or someone in the healthcare, legal, maybe it's even in just public services, field to talk with our caregivers, but it's open to the public. So on our website, coloradomadmoms.org, COMADMOMS.org, you'll see it listed as an event next week on the 19th. And for that event, we're featuring one of our moms. And she is an FNP and works at Peak Vista Community Health Centers in Colorado Springs. And her son has schizoaffective disorder and has been on clozapine for a couple of years. And so she's quite informed. And I'll be there, and there'll be a number of moms who have children who are loved ones who are on clozapine at this point and can kind of testify as to how effective it is and where there are issues, because all of these medications, all antipsychotics, have side effects, every single one of them.
Yeah.
And different ones. Some are more severe. For my son, Inveda Sustenna caused his eyes to roll up in his head, and he couldn't get them down. It caused
Oh my
horrible vision
gosh.
issues for him. So it tends to cause tardive dyskinesia, and on
Mm-hmm.
clozapine, the symptoms went away.
Wow.
So
Like a miracle.
clozapine actually helps heal, the neural connections, the neurons themselves, and it takes time, and but I always say, and my partner would say often, it's like watching him wake up from a coma because he was
Mm-hmm.
like a different person.
Wow.
He was shut down,
Oh.
and because most of the antipsychotics uh, actively try to suppress dopamine.
Yeah, I just want to say it's interesting that we're early to the research on this, like you just said. And that's what you were saying, that we're really early on into the research with this? Is that just because now we have the ability to have functional MRIs or yeah, okay.
Well, it's that and a lot of other, they're able now, they're numbering synapses and they know which ones do which things.
Okay.
So,
Yeah.
for instance, just to give as clozapine an example, but this is true, I'm sure, with many medications, they know exactly which, at least a range of synapses that clozapine attaches to, you
Oh
know,
wow.
chemically attaches
Wow.
to. Now, if you eat a lot of brassicas, which are like kale and broccoli, and they that can prevent the clozapine from attaching, as well
Wow.
as cigarette smoke.
Wow.
So, if people have are in my son's case, he was a smoker, and about 5, 6 months into taking clozapine, we were watching his clozapine serum level, meaning how much clozapine is in his bloodstream. They can
Hmm.
measure that. There's only like two places in the U.S. that do the test, but or can that have the labs that can actually give you the results. So his test, he gets this blood draw, and it goes to the Mayo Clinic, and then we get back the results saying his clozapine and his norclozapine level. I can't go into what norclozapine is, but all I know
It's
is
okay.
that the clozapine level for that most likely you're reaching a therapeutic level is maybe around 350. So his clozapine level was not going up. We couldn't even though his dosage was going up, his bloodstream wasn't going up. So he decided he wanted to quit smoking because I knew that it was affecting his and we were having to raise the meds and he didn't want to take more meds. So I said,
Hmm.
well, then you can quit smoking. So we went on to Chantix and he quit smoking. He hasn't smoked now in 3 years. And within 2 weeks, his clozapine level, serum level, doubled.
Wow.
So
Don't you?
we could reduce his medication. So talk about education. If you decide that, and again, clozapine can be used with people with schizophrenia, schizoaffective, bipolar. People with bipolar 1, they usually take a much lower dose than
Yeah,
someone with schizophrenia.
it would make sense.
So there's less of the brain involved or, you know, not working.
Yeah.
No, although the illness is, can be just as severe for sure.
Don't you
Um,
find it interesting? Sorry, just a side note that
okay.
at least in my situation, what I've noticed is that most of the mental health facilities my husband's been in, which is like practically every single one in the Denver metro area, all allow smoking.
Yeah.
That's so
Yeah.
interesting.
And it's partly because it does, there is some soothing quality to it. That's why people
Hmm.
smoke, because, a couple of puffs and they
Yeah,
calm down a little bit,
right.
and of course it's addictive. But yes, some places don't. My
Yeah,
son was
I hear
in,
him in the background being like, not all of that. I just,
yeah, yeah, my son was in one hospital that did not allow smoking. And he
yeah,
quit while he was there, but then he picked it up again. But
yeah,
yes, almost all, and residential facilities, the same thing. They all
so
allow
interesting.
smoking. And, instead, I don't know,
Well,
I
it's
don't
just we
know.
have so much to learn. Like that's basically what I'm
Yeah.
saying. And why then, since you seem to know a lot about clozapine now, why was it not FDA approved when it was this effective? Why did it take a national advocacy group to get this drug approved?
Well, that's pretty complex. I mean, it was actually invented in the 60s and was used some. And there was a particular case, I think it was in Finland, where there were 6 women who were prescribed clozapine who were over 65. And one thing that clozapine can do, it's the most dangerous side effect, is cause a drop in white blood cell count. And so, you can get an infection and
Mm,
die more easily if not treated. Well, 6 women in Finland did die. And
mm,
again, they were over 65. Their white blood cell count was not being monitored. I mean, this is way back when.
mm-hmm.
Um, Clozapine pretty much worldwide got pulled off the market, and
Oh,
some countries opened it up more, but I mean, I can't give you the exact timeline. It does exist, and there is a on the Anger Moms website, there is more detailed information about the sequence of events. But in, I think it's in 19, it's almost 35 years ago, the FDA decided to make it more difficult to get access to it. And they black boxed it, saying, oh, the risk of neutropenia is really high. That's the drop in white blood cell count. And it's a very dangerous medication, has all these side effects and yada, yada, yada. And that was pretty much based on some poor research.
interesting.
So 35 years ago, they put it into the REM system, or about 35. I'm not sure exactly. It may have been 25. But they put it into the REM system, which restricted, you could not get your medications for the first 6 months without a weekly blood draw to check
Okay. Oh, wow.
your level of
Oh, I did read this,
white
and this
blood
is
cell
why
count.
doctors didn't want to do it. They're like, I don't,
Yeah.
this is too much.
Well, it wasn't only that, the doctors had to register with the FDA if they were prescribing it. They had to order these labs and blood draws for once a week for 6 months, and then biweekly for 6 months, and then once a month for the rest of your life,
Wow.
even though you had never had any drop in white blood cell count. So it's come to light that less than 0.5% of people on clozapine develop neutropenia.
Wow. So we have research on that
So,
now.
so for 35 years, people were, dying from all the things that our loved ones die from, living on the street,
Yeah. Yeah.
um, you know, anyway, or committing crimes, or suicide. And it ends up, I should say this about clozapine also, because I think it's very important. Clozapine, at this point, the APA recommends that after you've tried two antipsychotics and they've failed, you're considered to be to have treatment resistant schizophrenia. And the third medication should be clozapine.
Who recommends that now?
The American Psychiatric Association.
Wow.
Yeah, and that's been true for years, but doctors didn't do it. So they have
Wow.
trained, if you think about, I mean, when you have a medication of 35 years being restricted, really hard to prescribe, not only did they have to get the weekly blood draws, but those results had to be sent to the pharmacy, or the pharmacy could not give you the medications.
Wow.
So if there was a problem with the lab, this happened with my son. The wrong tube was used by the nurse, the technician, to draw his blood. It was sent off to a laboratory. This is for what a CBC, whatever the name is, one that takes hours. Usually, you can have
Yeah.
results in a couple of
Yeah.
hours. Any lab can do it. It doesn't have to go to the Mayo Clinic or anything. You get those fairly fast. 10 days. I kept calling and saying, what's the problem? We need to pick up his meds. He's going to be out of meds on, Sunday. Well, by Friday afternoon, I'm panicking. I can't reach any of his medical providers. They're off for the Friday. They're off for the weekend. I call the clinic. I mean, actually, I walked into the clinic where the blood had been taken, and they were like, well, it went to the lab. And I'm like, yeah, well, that was 10 days ago. You should have results by now. So it was like, oh, yeah, well, his doctor's not in today, and da 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 da. And so then I called the pharmacy, and I have worked with this pharmacist for, I don't know, 8 years or something at a Genoa pharmacy, which is usually, they're located inside the lobby of most mental health agencies. where so they have special relationship and they're right there. So people walk out of their psychiatrist or psychologist office and they pick up their script right there. So it's a wonderful relationship actually, and they were quite responsive. The man who runs that particular one said, "Well, I can't give you any meds." I said, "He's going to be out on Monday. Clozapine is not an injection. It's only pills. They've never developed it, and they probably won't because it's out of copyright at this point. They've never developed an injectable version of it, and so it's life in terms of, I forget what it's called, is 48 hours.
Oh,
So
whoa.
after 48 hours, it's likely that you'll start developing psychosis symptoms and other very severe withdrawal
Oh,
symptoms. I mean, it's
wow.
dangerous to go off clozapine suddenly.
Yeah.
And he would not. And I said, listen, you know, it- 2 years ago, the REM system was they reduced some of the restrictions. And you have the right to give me a week's worth of meds until this lab situation is figured out.
Love an educated woman.
Yeah, yeah. And he said, well, no, it's company policy. We can't do that. And I'm like, okay, I will call REMS. Here's the number. You can call them and ask them this in DC. And he says, no, I'm not going to call them. It's company policy. I said, okay, I will call them. I picked up the phone. I called REMS, gave them his number. They called him, and he said, okay, I have a week's worth of meds for you.
Wow.
But I immediately moved my prescription services from that company.
Yeah.
So now my son gets once a month, he gets his meds sent to him from California,
Wow.
like clockwork. It's
Nice.
beautiful.
That is.
Yeah. So what happened for many years, and you can imagine someone who's been on clozapine 20 years still having to go once a month and get a blood draw.
Yeah, seems.
Now it's my son gets one quarterly,
Okay.
so
Yeah.
that's mainly, he's never had a real drop in neutropenia. So, that's or in white blood cell count. So if it occurs, it tends to occur in the first 18 weeks. So now the international guidelines are the doctor monitors just like they would any other medication that can cause this. And clozapine is 34 on the list of medications that can
Wow.
cause. Most of them are cancer medications.
Oh,
Okay.
okay.
But even olanzapine is higher in terms of likelihood of causing a drop in white blood cell count.
So it
So
just seems
we
like it
thought,
was in an overabundance of caution that they just,
exactly.
yeah.
Yeah. The phrase we coined was the greatest risk of clozapine is not getting clozapine.
Yeah, yeah, because it's very dangerous, like you said, to have episodes. So, yeah,
Yeah, and
amazing.
yeah, and it's an amazing medication. So Elizabeth's speaking next week in December, on December 10th, and on December 11th, we're bringing in Dr. Robert Lakeman and his wife, Ann Mandel Lakeman, to Colorado Springs and to Denver to do public programs. So,
Wow.
again, on our website, flyers for both of those are up, and you can register mainly because, we know how much catering to order, but the film, documentary film, Into the Light, which is a couple of years old, but is about clozapine and has a lot of testimonials about people who are on clozapine and their families and all, is going to be screened. And then Dr. Lateman and Mandel are going to also do a talk and a Q&A. And then Daniel Lateman, who has schizophrenia and was really, I give him credit saying, Daniel, you were the one who inspired your father to do all the research to change the world in terms of
Oh,
clozapine. And he's a stand-up comedian now. He's
I
on
love that.
Yep, he performs in Manhattan, and so he's appearing and going to do a half-hour stand-up
Fun.
also. So I hope you will come for the
Yeah, I
event.
see if I can make it. As
Yeah,
far
yeah.
as the
Well,
recording that you're gonna have November 19th, or the Zoom that you're gonna have, or do you have those like previous recordings up anywhere, or is it kind of like you
yeah.
have to be there live?
No, they're all up on our website.
Awesome.
Yeah.
Okay.
Yeah. So
Well,
I think it's under events. I'm pretty
okay.
sure under events tab. So all of the recordings, and we've had, DAs, we've had, the head of the state hospitals, we've had lawyers, we've had people who run homeless shelters. We've had a full spectrum of people speak. So please, there's a lot of information there. We also have on our website all of our newsletters. Now, we issue a biweekly newsletter. They're all there under our news tab, archived there and changing every 2 weeks. Um, and we have on our advocacy page, we will have, as soon as the session gets rolling, we will have the bills that we will be fighting for and testifying at. We'll have letters that can be downloaded and sent to your representatives and senators. Um, we will we do have on there training. So last January, we held a day-long Zoom advocacy training event with
Wow.
Leslie Carpenter from the Treatment Advocacy Center. It's becoming more and more robust. I mean, we're only about 15 months old, so
Yeah, you've
it's been a
really
sprint.
Yeah, you're really amazing. I'm so inspired by you. So thank you so much just for coming on, talking about what you're doing with Colorado Mad Moms. I tell people all the time, even though it is in Colorado, the resources that you have on your website can be applicable a lot of times
Yeah,
to you if you're anywhere in the US. Obviously, like you said, bills and things and stuff like that might be specific to Colorado, but there is like, it's exactly what, like you're echoing what Brooke and I say. It's education, then it's advocacy, and like this is what we're all doing, and we all have to stick
yeah,
together because
we do.
we're the ones that have to make a change. So
Yeah. This is going on nationally. I mean, there
yeah.
are wonderful organizations. There's the Arizona Mad Moms, which was born, I don't know, 8 months before us.
Okay.
Um, and they focus on issues in Arizona. There's the National Shattering Silence Network. Um, they also are National Shattering Silence Coalition. We are a partner of theirs. So we bring our state issues and our advocacy out and spread it nationally, to those organizations. They produce a lot of wonderful materials, that are great resources. And, laws vary state to state,
Yeah.
but there's a lot of us working together now and learning from each other in terms of how to change, the laws in our particular state, so we're looking at, you know, competency statutes in Iowa,
Yeah.
or in Arizona, or we're looking at AOT, which is assistant outpatient therapy, which is an amazing program that is really quite successful in keeping people out of jail because it's kind
Yeah,
of
wouldn't
like
that
an
be
act.
nice?
Yeah,
Instead of a
exactly.
social worker telling you, oh, we'll hook you up with an appointment right after they leave, and then there's no appointment and they're home. It's like, all
There
right,
you go.
cool.
Exactly. So it's much more wraparound, but in
Yeah.
the justice system, as well as mental health agency and services, so it helps support that person. And so some states are doing that statewide. New
Yeah,
York
I'm gonna put
State,
those in I'll put these links. I'll get that information from you. Make sure I have these like links in our comments and our show
very
notes.
good.
So
Very good. Yeah,
yeah.
there's a lot of great material out there. Our Facebook page is
Yes.
turning out, it's a private group. Just make sure to answer the questions so that I can approve you. But there's a lot of information there, and it's great support. And if you're somewhere in Colorado and you're really alone and you don't know what to do next, you know, you get on there and you ask questions, and
Yeah.
people very quickly will welcome you, will. help you in any way they can. And a lot of times they have a lot of information. You
Yeah,
know,
they do.
we're amazing. We're,
I will agree that you all
yeah,
really are. I'm definitely
yeah.
in that group, and it is a great group. So, Kate, thank you for everything that you do. Just as you know, I know you said you would like to retire, but I don't see that happening anytime soon because we need you.
Well, I am retired, but I'm not retired from
but you're still
Colorado.
working. I mean,
Yeah, but
yeah,
we're building. We've got a great welcome team, a
yeah.
great advocacy team, so and an education team. So, people are taking more pieces of the load off of me. So I'm happy about. I'm grateful for that. So
Yeah, that's
anyway,
a
thank
great.
you. Thank
Yeah,
you,
thank
Laura.
you. Thank you everyone for tuning into today's episode of Bipolar Lines Pod. Be sure to follow us and subscribe, and be sure to check out our face group as well, Bipolar Lines Pod. It's an anonymous group, like I said in the intro, where you can post anonymously. Thank you so much, Kate. I'm sure we'll be in touch.
We will. Okay.
Thank
Bye-bye.
you, everyone. Thank you for showing up for your person, and we'll see you next time.